Hello and Assalamu alaikum. This tutorial is about family counseling. Family counseling is a vast and diverse topic due to which this topic will be covered in multiple parts that you may find on my YouTube channel. There has been a rise in popularity of marriage, couple, and family counseling, which has brought dramatic changes in the form, composition, structure, and emphasis of the families, which have been noted earlier. So, regarding the pioneers and contemporary leaders in family counseling, there have been a number of helping specialists who have rendered their services in advancing the field of family counseling, and we'll be referring to a few of them. For example, majorly, it is the work of Ackerman, who was basically a psychoanalyst who used to utilize the concepts and theory of psychoanalysis in order to treat the families. And eventually, he made the family therapy respected in the profession of psychiatry by contributing his services in family counseling. In around 1950s, it was Ackerman, Theodore Litz, Lehman, Wien, Murray Bowen. Bowen is very much famous for his theory of family system theory, and Carl Whittaker all broke away from the psychodynamics because they saw that something that was dysfunctional, a dysfunctional behavior was actually present in the family dynamics, whether it was the present or past family life of the individual. Similarly, Palo Alto, California, Giorgio Bateson, J. Haley, John Jackson, John Wiegland, and Milton Erickson, they developed their strategic family therapy. Around in 1960s, there have been a group movement which had an impact on the emergence of couple and family counseling. Specifically, it was John Bell who started treating families as a group and began the practice of couple and group counseling for the families. Similarly, there have been theorists like Salvador Menachen, who is very much famous for his theory of or therapy of the structural family therapy, and Palazzoli, a creator of form of strategic family therapy known as Milan approach, which is very common. And similarly, White and Epstein, who are actually the founders of narrative therapy, all these people, and these are just a few names who have contributed in developing family counseling. There have been numerous names that we can call and talk about. Uh, at the end, it had been Gottman and Jacobson who have helped practitioners understand better the dynamics within the families, especially those factors which are actually relevant to violence at homes, which is we label it to be domestic violence, and high functioning or dysfunctioning relationships within the family. Uh, Here we will start with the family life cycle stages that have been provided by Beckwer and Beckwer in 2009, who outline a nine-stage cycle that begins with the unattached adult and continues through the retirement. So the first stage is unattached adult, which is unattached adult or a single adult who actually leaves the home. So because of the reason that the model is based on the Western concepts, so that is why we are using the terminology that single adult leaves the home because that is a practice in the West that when the child becomes or the adolescent becomes or adult becomes independent, they leave the home and they are much independent in their earning and they have their own setup of living. So the unattached adult, the emotion that the adult would be having would be accepting the parent offspring separation. So in our culture, it is slightly different because the parents and the child, they are very much attached to each other, and it is the conception that is kept in mind that if it is a male child, so the child is responsible for bearing the responsibilities of the parents, and he is supposed to take care of the parents. Similarly, the female child who leaves the house after getting married, and till the time she is at the home, she is responsible for abiding by the rules and regulations set by the family. However, as the theory suggests that the stage critical tasks are differentiation from the family of origin. We do not find much of this differentiation from the family origin because in Pakistan, generally the conception is that family is a one unit. And we often see that there is a lot of overprotection and control in the family. However, in West, it is perceived to be something dysfunctional. However, different researchers and different theories, even my PhD thesis also reports about it, that the uh, Asian families, they do not see control as something dysfunctional or unhealthy. Rather, they see it as a part of warmth and care. And then the critical task is development of peer relations. So yes, the peer group becomes much more important in comparison to family. And we also find that there is initiation of the career, sometimes due to which people move from the family to some other city or some other place for pursuing their jobs. Stage two is newly married, or you can say that there is formation of marital system that takes place, and that is the critical task that is present. And it is efforts are made to make some kind of room for the spouse within the family, because as the new members join a family as well as friends, so there is space has to be made for that individual if the person accepts that, so that person would be able to make space. And then adjusting the career demands as well. The person has newly got married, and the person is also responsible for bearing the responsibilities of wife or the husband or the other family members. So it takes to adjust or balance the family life and the job life. So the emotion that is present here is commitment to the marriage. Stage three is known as childbearing, that is accepting new members into the family, that is the new emotion. And the critical stage task is adjusting marriage to make room for the child now. Previously, in the previous one, the room was made for the spouse, and now the room is being made for the child. And there are many families that we find that if they are not ready for childbearing, then the clashes and difficulties spring in. And same goes because when it is about the Asian families or Pakistani families, so there is a lot of pressure on the new couple to have the higher of the family. So it's the elderlies in the home, they are very much pressurizing for the family. So it depends that how these things are handled, and then adjusting to all these things and taking the parenting role, whether the person is ready for taking up the parenting role or not. There are multiple responsibilities, tasks and finances to be managed as well. Stage 4 is about the preschool age child, when the parenting role has been accepted and the child is being reared and cared within the family, and the child comes of an age when he or she has to be sent to the school. So till that time period, as Freud says, that there will be a personality that would be developed. So the emotion here is accepting the new personality, and the stage critical tasks are adjusting marriage to make adjusting family to the needs of specific children, and coping with the energy drain and lack of privacy, because the child would be always bringing up and would be having his or her own queries. The child is curious for a number of things. He would be having a number of new experiences at school. He would like to share them, or you may notice that the child is changing or the personality type is changing. So taking time out to be a couple becomes difficult at this specific stage. So that may bring upon different kind of conflicts within the couple. Stage 5 is school age child, allowing the child to establish relationship outside the family, and here the peers become important. So the stage critical task is extending family, and we can say that rather than just extending the family, it's more like extending the social interactions. So, encouraging the child's educational progress and his interaction with the peers as well as teachers, it becomes a critical task. Dealing with the increased activity and time demands, because nowadays we do find that there are parent PTMs for which the parent has to take up time and has to visit, and things are to be discussed, and there are a number of tasks which have to be performed at home. There are different activities which are assigned, there are models which have to be assigned to the children, and the child has to work for it within the home. Stage 6 is known as teenage child. uh, the emotion present in this stage is increasing flexibility of family boundaries to allow for independence. As it is always said that teenage is a very sensitive age, and here the child wants to experiment new things, want to have more autonomy, and in most cases indulges in new experimentations and risk-taking activities. So there is the critical task is that there has to be a shifting of the balance in the parent-child relationship. This is a very sensitive age where the parent-child relationship becomes more important. There has to be a refocusing on the midlife career as well, because it would be an important career stage for the parent who is working as well as for the child who is teenage. That is again very much important, and there may be some kind of marital issues which may be experienced. So there is also, if it is a joint family, so there will be elderly people in the family as well. So there will be increasing concern for the elderly generation or older generation. There will be medical checkups frequently, as well as there may be some kind of new requirements of the older people at home. Stage 7 is the launching center where generally the children move out of the family. The emotion is accepting exits from and entries into the family. There will maybe new family members who would be entering. Western concepts may there are boyfriends and girlfriends, so there are new relationships. Similarly, in the Asian zone, or you can say Pakistani communities, Pakistani families, it is the stage where the child comes of an age that he or she has to get married. So the critical task is releasing the adult children into work, so they are becoming more independent, or you can say that they are moving out of the family in order to join college at some other um, city or some other country, or it may be releasing children through the marriage. Maintaining supportive home base has to be there. Then accepting occasional returns of the children, that is if they are at the college or if they are have gone for work at some other place, so they will be occasionally visiting home. So again, accepting their visits is a critical task. Stage 8 is known as middle age adult. It is embedded by the emotion that one has to let go of the children and then facing each other. The critical task is rebuilding the marriage, welcoming the children's spouses as well as at times grandchildren into the family, caring for them, and taking time out for them, dealing with the aging of one's own self as well as aging of the partner, if the partner is still alive, and if the partner is not alive, dealing with the absence of a partner is also a critical task. Stage 9, that is the last stage of the family life cycle stages, is known as emptiness or retirement and old age. The emotion is regarding retirement, accepting retirement, and accepting aging and old age. However, the critical task is maintaining the individual and couple functioning, supporting the middle generation, that would be generally the children who would be having their own children. So, obviously, they will be having issues regarding their own children, their own problems. Coping with the death of a parent might be there in the family, or death of the spouse. Another critical task may be closing or adapting the family home. Sometimes it's, for example, we can take an example that children have moved out and the parents are living alone, or parents are living together in their home, and the parents are too old, or they are ill, or one of the parents dies. So the other parent moves to the new family, or the children living in another house. So it would be like adapting to the new family environment that is already there, which they might not be familiar with. The family life cycle stages tend to involve a specific period of time throughout the lifespan, emotions the individuals experience, and critical tasks to be accomplished in each stage. The two concepts of healthy functioning and dysfunctioning are very much important in family counseling. A good family functioning is based on the diversity. However, the poor family functioning or dysfunctioning is basically a result of rigidity and the narrowness. The goal of the therapy is to offer more complexity rather than just to provide an explanation as to family's dysfunction. Pathology is looked upon, uh, more importantly, what is the relationship, what are the boundaries within families, what are the patterns of communication and interaction among the family members, they are looked upon. The counselor also tries to look for the circular causality, and it's not the linear causality that is present over there. Feelings are not as relevant as the actions. Focus of therapy is not insight, rather than to develop some kind of change in the behavior for the family. In order to understand the family counseling, it is very much important to know that how family intervention is carried out. It would be significant if we focus about the stages. So the first stage is pre-session planning, which means that the therapist actually plans out or determines in advance that who would be actually attending the session. That is, for example, that who will be the focus of the session, who will be attending the session. There is a possibility, for example, that there is, for example, a child who is the patient, who is the identified patient, and he or she would be coming with, or would be accompanied by the mother or father or both parents, or in the session it would be that the child who is the identified patient would be present, the mother would be present, father would be present, as well as the siblings would be present. So it has to be identified in the pre-session planning that who would attend the session. Talking about the identified patient is an individual who is seen as the cause of trouble within the family structure, whom the family members consider that that person is actually the root cause of all problems, and generally that person is taken as a form of a ticket into entry of the family counseling session, or in other situations, we can also say that that person is considered to be a ticket for indulging into any kind of conflicts or fights at home. Most family counseling practitioners do not view one member of the family as a problem, but rather they work with the whole family as a family system, as one unit. And it is usually the focus is individual perspective as well as group perspective. And even when the focus is made on one individual, the outcome is perceived to be changes in uh, that one particular person who is the identified patient or who is the accompanied person, and the focus is being made on that person and changes is being brought to that person, would have eventually a ripple effect. That is, it one person change will automatically bring upon the change in the other people. The second stage is the joining stage. The therapist joins the family, taking on their effective tone, tempo, language, and structure, and discuss with them whatever is the problem experienced by, or how the problem is actually seen by each individual member of the family. The third stage is the problem statement stage, and as mentioned earlier, that who is the identified patient. But in the problem statement phase, we do not actually I would not say that we do not focus on identified patient. Rather, I would say that we do not begin our questioning with the identified patient. Usually, what we do is that we involve the adult who has the least involvement with the problem. That person is actually addressed first. That is, we ask questions like that: when the therapy is over, how will your family be different? So that gives an information regarding that what is the problem they are experiencing or they are defining as a problem, and when they will get rid of that problem, how the family life would be. The fourth stage is the interaction stage. The therapist focuses on determining the patterns of interaction and sustaining the problem. Another stage that often comes in family counseling is the in session conference. Here, what is done is that the counselor or the therapist leaves the family for a few minutes and confers with the observers or takes a moment alone to think about what has been said and how that relates to the hypothesis of the counselor regarding the problem. Another stage is known as goal setting stage. The therapist or the counselor reaches an agreement with the family on the solvable problem, stated in behavioral terms, so that all involved will know that when the problem has been solved, what is the problem and when the problem has been solved. So the goal is set with the consent as well as discussion with the family. Another stage is ending stage. The therapist sets the next appointment and indicates which family members will be present for the next session. When working with a team, more frequently, another stage that comes in the same session is the post session. When working with a team or a family, a post session briefing should occur. And this debriefing is very much important to produce feedback regarding the perceptions of the family members who have been in the session. And if working alone, then this is the time that the counselor needs to record his or her own impressions regarding the problem as well as regarding the solution of the problem. Thank you folks for watching. If you like this video, make sure to subscribe for more and like and share the video. Click the small bell icon that appears beside the subscription button to receive the notification the minute our video is uploaded. Thank you for watching. Allah Hafiz.